Welcome. I'm Randy Tawaniak, owner of Expedia Cruises Edmonton West location. It's January 2021, and this will be the year that many of us will begin to travel again and see the world. Travel will be different and in some ways more complicated as we deal with COVID issues in our own country and in countries around the world. There will be new rules with each country deciding on its entry requirements, and pre-testing, COVID testing may be required. We want to make sure our clients get back to traveling safely and are informed of the new policies and procedures. My team of 24 professional vacation consultants are here for you, not only to help you plan your bucket list travels, but also to help you navigate through the new complexities of travel so we can help you get back to traveling and doing it safely. Today, we bring you Fatima Da Silva, Regional Sales and Marketing Manager for Norwegian Cruise Line. Fatima will be letting us know what NCL is doing and has done to make sure you can sail safely on the oceans. The protocols and safety measures Norwegian Cruise Line has put into place are ever changing based on current scientific data and country requirements to ensure maximum safety for crew, passengers, and the countries they visit. Welcome back, Fatima.
Thank you. Thank you. Yeah, thank you for inviting me. I'm happy to be here. So excited. Welcome. So thank you for listening to us today. So I'm going to just go over what Norwegian Cruise Line has set for the health and safety. And like Randy had mentioned, things are going to be changing as we go along, of course. So we're going to get started. So here's a couple of things that we're concentrating on. So you can see that we have 6 key areas of health and safety measures that we've actually put together. So we'll be implementing all of them across all of our 17 ships. So a couple of fantastic ones that we're doing is, of course, new air filtrations across the entire fleet. So all of the staterooms will have the HEPA air filtrations, and those are the filtrations that all the hospitals use. We will actually even be using those on our vacuums. That's going to be on through all of our ships. Another one that, of course, we're all getting used to doing, we've been doing it for almost a year, is social distancing. So that is one thing that we'll all notice, especially on our bigger ships. We're going to have reduced capacity. And that's how we're going to control the social distancing. Another one that we're working on right now is enhanced medical resources. So we will actually have a COVID-19 officer, and his role will just be dealing with COVID-19. Another one too is screening protocols. We will be having testing done prior to getting on the ship. We'll also have testing at the pier, and then of course throughout your vacation. So our medical center will actually be having COVID tests, and we will also have access to vaccines also. Another one too that we will be changing, and you'll notice the most, of course, is the temperature checks. We'll actually have temperature checks throughout the ship. Example, like if you're going to see a show, your temperature will be checked. Every time you get disembark or embark onto the ship, your temperature will also be checked. And then also pre-embarkation health screening. That's something that will also be new for you also. And then of course, crew. That's one question I get a lot is, how about the crew? So the crew is going to be constantly monitoring crew health. They'll also be going through pre-employment medical examinations, and they will be also being tested throughout their contracts. So as of right now, we actually have crew on the ships. They actually had to do their quarantine on the ship and then also get tested on a regular basis. So that is what the crews will be going through. Like I mentioned on my first slide, the air filtrations. So that will be across the entire fleet, and that actually has been done already on all of the ships. As anyone that has traveled on Norwegian, you all know that we're very washy-washies. You have our gentlemen running around the ship with their spray bottles and doing washy-washy. So you'll actually see a lot more of those around the ship. So we are increasing our sanitation measures. We will be fogging all the staterooms, all the hallways throughout your vacation. We will also have a 24/7 prevention schedule. One thing that's going to be changing is the buffet and the beverage stations. That's now going to be all full service. So that is something that I guess we'll all really notice a big change in that, because we're so used to always going to the buffet and picking what we want. It's going to be great for control appetite, especially for me, because I tend to go to the buffet and fill up my plate. So that's going to really help me a lot. And then again, like I had mentioned, social distancing. We'll be capping capacity on the ships. Also, all public areas will also have limited capacity also. We're also going to have a staggered embarkation advanced online check-in. So that's something that's also going to be new. You're going to be able to do all your online check-in prior to going to the pier. And then we'll also be very strict. I know with myself, you would put, oh, I'm going to check in between, 10 o'clock and 12 o'clock. That's one thing that you really notice is we're going to be really strict. So we're only going to be checking in the clients that did check in for that specific time. Also, onboard activities. So as you all know, we used to have 2 nightly shows on our ships. So it's probably going to look like we're going to have 3 shows because we're not able to have full theaters. And then, of course, with our fantastic entertainment, everybody, of course, wants to go and see Kinky Boots and the Jersey Boys on the Bliss. So we're going to have to add more nightly entertainment across the fleet. Enhanced medical resources. So we're going to be, like I mentioned, a public health officer position that's going to be only dealing with COVID. We're also going to increase our medical team. So more doctors, more nurses on our ships, and also full equipped latest testing kits and medical supplies for COVID. And then one thing that we're also going to be doing is dedicated isolation accommodations. So any of the inside staterooms that are around the medical center, those are going to be closed off for COVID cases, so that we can you can isolate inside one of those staterooms instead of inside the medical center, etc. And then also enhance health and safety training. All of our staff that are on the ships, as I'm speaking right now, they are all going through enhanced health and safety training. So no staff will be going on the ship without going through this intense training. And then, of course, another one that I get asked a lot is extended ship-to-shore safety. So we are going to be making sure that every port that we stop at will be doing the same protocols as we are. So any shore excursions, any ports, they will have to be doing the testing and also the experience, so that you're going through the same experience at the port, same as what you're going through on the ship. So the other one too, we will only visit safe open ports of call. So that is one thing that you will see when we start sailing, that we will only be going into ports of call, of course, that will allow us, of course, and that are safety for you. So our itineraries are going to be top priority for safety for you and your family. And that's it for now. Just make sure that you keep in touch with your Expedia Cruises consultant, because things are changing, as you know, changing every single day. And they're the first ones to hear what's new and what's changing and what's coming up. So make sure that you keep in touch, even if it's just a hi, anything new, because that is really important. And that's it. Thank you.
Excellent. Thank you for that, Fatima. Can't wait to get back on the water with you.
Same here.
we definitely appreciate everybody taking the time to watch this video, and we look forward to helping you plan your future trips.